today. All right, so welcome everyone. If you see anyone pop in that says they're waiting, please go ahead and accept them. I may not be able to see it as I'm presenting. But I am Mary Corman. I am the Public Health School Liaison here at the Allen County Department of Health. And today we have three great groups of guest speakers, and they will be talking about the different resources for youth mental health here in Allen County. I do apologize that my screen is showing you the non-full screen version. And if everybody can please mute your microphones as you join, that would be great. So I will go ahead and get started. Sorry, I'm having minor technical difficulties today. Just some follow-up for today's meeting. If you would like the slides sent to you, please put your email address in the chat right now. I will be sending out some resources. You are more than welcome to ask questions in the chat. I know the AI thing is recording. I don't know if you're seeing that as well, but please put your questions in the chat. We will get to those at the very end of the meeting. And this recording will be posted on YouTube and onto our school outreach webpage later this week. So that is our YouTube handle if you're not already a follower of our YouTube page. And then the school outreach page, I have the link there, and I will also be sending that out in the follow-up email. All right, so today's topics, I will briefly go over what the school liaison updates are for the month. And I'm going to introduce you guys to our public health student heroes. We have 8 students here in Allen County that are working with me, and they have some great deliverables that are finally ready. So I'll be sharing those with you and where you can download them to use in your schools. And then we have 4 guest speakers from 3 organizations on mental health. I will also be sharing some information on some new mental health pamphlets from the Indiana Department of Health. So again, please save any questions for the end. So we should have about 10 minutes. So if you haven't met me, or if you haven't gotten my many emails over the last year, I am the public health school liaison here for the county health department. So my main role is to be the primary point of contact for any schools or anyone that has questions related to public health. So if you have a strange illness, if you're unsure about how cold is too cold to send kids outside, you can always send me an email or call me. The second number listed there is my work cell phone. You can also text me during the day. We have a lot of online resources, and you can see from our link there, this list is growing every day. So I publish a restroom reader once a month, which we suggest people hang in bathroom stalls or on bathroom mirrors to get kids to read it. We have little riddles on that, and it's just sort of a one-page public health handout each month. On the school outreach page, we also have a number of PDF handouts that we sort of create for school nurses. So it's things like hand, foot, and mouth, lice, common issues that come up in schools that you can print and give to students or parents. And then we have a number of FAPE documents and the Public Health Student Heroes deliverables. And if everybody can please mute your microphones, I would appreciate it. For in-school programming, I have been really busy. This is taking off. I'm doing a number of free classes for any students preschool through 12. I'm also working with some Boy Scout and Girl Scout groups, so we can also do after-school programs. But those are courses related to things like hygiene, hand washing, infant safe sleep. The full list is shown on that flyer on the right, which I will be emailing out at the end. Our new course that we just completed is a food safety class, and it's really interactive. It teaches kids how to prevent food poisoning, and we are hoping to be developing a course here soon focused on water safety. So that will come out more toward the end of the school year. We are still doing free CPR, Stop the Bleed, Safe Sitter, and Catch My Breath trainings, and those can be for students or for teachers. So if you'd like to get one of those scheduled, please let me know.
What?
All right, so again, our school outreach page, I know I've mentioned this a few times, but this is where you can find everything I'm referring to. It is within the Allen County Department of Health website, and that has all my contact information and all the information on these courses. The featured course, and I talked about this last time, is our new Safe Babysitter course. So this is a long one. It's about 8 hours long, so we recommend splitting it over 2 days or over one long day, like a Saturday. It's made for middle or high school students, and they get a full CPR certification, the full Safe Sitter Essential certification with the handbook, and then we do the Parkview Safe Infant Sleep which also covers shaken baby syndrome and choking. So if you have students in your school that are around the age they're taking care of siblings or they're going to start babysitting, this is an excellent course. It's totally free, and we can do 6 kids at a time. So if you'd like to schedule that, we're hoping to get a few more of those classes scheduled. So feel free to email me and let me know. We do also have a flyer to send home to parents. Update on pediatric pneumonia. This is still an ongoing situation. So we are still monitoring cases. It's still higher than average across the county. So if you are seeing cases of pneumonia, or if you're hearing about, students or staff members, please let us know as those cases come in. This is not required to track, but we would greatly appreciate your help. We're just trying to get a handle on how bad the situation is. I do have a line list that I can send to you. So if you don't already have that, send me an email and I can get you a copy of it. If you have specific questions on the pediatric pneumonia situation, you can always contact me, or you can contact Laura Weaver. Her information is shared there at the bottom, and she is who I would be directing you to manage those outbreaks. And lastly, I'm very proud of a program I started in September. It's called the Public Health Student Heroes. So I had a number of kids from across the county apply for this program, and we have 8 high school kids. They have been meeting with me twice a month, and we educate them on certain topics, and then they create deliverables, sort of in like a PSA style. And I'm going to move the PowerPoint for just a second. So if you go on to our school page here, if you scroll down, there's a whole section for Public Health Student Heroes, and we will be adding 4 to 6 deliverables each month. So a few things the kids have made this month is they made a number of posters. Oops. So you can see these posters are designed to be printed and hung in schools. And there's a few different ones that they made. They also have made, and I'm not going to play all of these just for sake of time. There's 2 videos and an audio clip that we posted to YouTube. And these are entirely made by students, but they are approved by us. So feel free to download those. Please use those on your school social media. You can use them on morning announcements. One of the videos does actually feature the different students. So if you do plan to use those at all, please let us know. The kids are really excited. They just submitted their deliverables to me about fentanyl and overdoses. And those will be coming out probably first week of January. And those, they actually interviewed the parents that had lost a child to a fentanyl overdose. And they did a really good job. They're very powerful and very effective deliverables. They also have an audio clip about fentanyl focused on New Year's. So it'll be pretty timely. It'll come out right after New Year's Day. All right, so segueing into the mental health topic for today, the Indiana Department of Health just created 3 new pamphlets, and they're designed for students. So the first one is just about starting the conversation about mental health and suicide. The second is mental health overall awareness. And the third is specifically talking about suicide. If you would like to order any of those pamphlets, you can see Olivia's contact information there at the bottom. She said just to send her an email, and she can either send those to you as a PDF, or they can work with you on ordering hard copies. All right, and I did not talk a full 10 minutes, so I am going to go ahead and hand this over. So our guest speakers today are from 3 local organizations. So we have Bowen Health, Maple Heights Behavioral Health, and Parkview Behavioral Health. And we will go ahead and start with Bowen. We have 2 speakers from Bowen today. We have Tim Nussbaum. He is the VP of Business Development, and Jamie Yates. She is the Director of Community Engagement. So I will hand it over and stop sharing. And Tim, you can take it away.
Okay, well, good morning. Thanks for attending this. We got a 5 minutes to go over, all kinds of neat stuff. Usually about this time of the year, I get called in to do something that sounds more like a 22 New Year's resolutions even you can keep. Everybody starts to think about, how they can make their lives better, families better. And, as we're talking today, these youth and the kids that we might have land in our lap, and, how do we have conversations with them? So Jamie, I'll let you introduce yourself. We're going to touch on a few slides with you here. So Jamie, go ahead and introduce yourself.
Sure. Thanks, Tim. As Mary mentioned, I'm Jamie Yates. I'm the Director of Community Engagement focused on Allen County. It's a pleasure to be with you all today.
Okay, I am hoping you can see the slide I've got up there. That is obviously our names and titles, but when I think of, where I'd like to go just quickly, and we think of resources, I think we think of programs. Mary put up a bunch of great stuff that the health department's putting out. Dick and Heather, we all do great things in the community. We really do. And sometimes we think it's just somebody else's issue, or are there another program we can refer to? I want to challenge everybody here just for a second to think you're also a resource. Okay. And I wanted to let you all know just something that might be helpful as these kids or people approach you at this time of the year, and they're looking for something, and they're looking for a direction. They're coming to you because they trust you. A quick little framework we often like to remind people of is when that lands on your lap, sometimes the first thing we think is, oh, I want to say the right thing. I don't want to miss this opportunity. I want to make sure they know what to do, and I don't want to miss this. Something that can keep just some helpful tips for you. It's just 4 quick things. And this comes out of debriefing models like the CISM or mental health first aid, just any kind of little debriefing tip. The 4 basics, okay? Let them tell the story to you. What's on their mind? What's the facts? What's going on? Let them tell you, all right? And after they're done talking to you a little bit, it's okay to just say, well, what do you think about that? Okay? Their story leads to some thoughts that they have. They'll tell you probably some thoughts that they have. And after you listen to those things, another great step to go to then would be, how do you feel about all this? All right. Now, you're not being a counselor. I don't want to go there with you. Okay. You're not being a counselor, but it is a natural progression of when things happen, we think about things, we feel about things. Ask, what are some of your thoughts? And the last thing we probably would recommend to you is you're a resource to them in that moment is just finish the final question and be, what's affecting you the most? They're going to tell you. All right. What you're doing is you're bringing them to a spot where then they're probably able to make decisions better. They're able to maybe listen to you, what maybe some suggestions might be. Have you talked to your parents about this? Is there someone else at the school we bring in the conversation? Have you thought about this or that? You're getting them to a point with just those 4 things that you can walk them through. So before I go into all the Bowen resources, I want to knight all of you as you're a resource too, and just remember those 4 things as you have those conversations with the kiddos. So anyways, some programs that are out there. Obviously, I'm talking to a lot of people that are with schools right now, and you may have some of these programs. I'm going to quick go over them. These are great referrals too for parents. We have the Head to Toe program, which is some of these issues that are coming to us have to do with primary care needs. We know primary care needs can often interface with mental health needs, vice versa. And Bowen being an FQHC now, we are able to offer primary care needs. And the Head to Toe program is where a nurse is involved in a warm handoff to that parent to get their needs met. We also have Better View. Better View is an in-school opportunity where they have some video opportunity to engage with a therapist. Pretty simple program. We also have skills coaching where some of these kids, they have a rough patch in their day, and we can assign a person with them through a portion of their day to help them in the moment they're in. Also lines up very well with therapy. And then some of the schools in Allen County, you've got student assistance program. These are prepaid sessions that the schools purchased, and the kids can access those prepaid sessions for counseling and get a first chance of what does that look like. So those are some programs that we do have. I'm going to kick it over to Jamie now. Is what actually would happen in the office setting. So I'll kick it over to Jamie.
Yeah, thanks, Tim. And thanks for going through those programs that we have developed based on feedback that we've received from the schools. So it's wonderful that we have those programs in place, but we also recognize that, when children are in crisis and perhaps they need a resource outside of school, we also want to equip you with information for the families. And so We have 2 outpatient settings here in Allen County, one on Rudisill Plaza and one in Goshen Road. And one thing we strive for is consistent experience. And so any of the people that walk through our doors, what they can expect is a professional, welcoming experience, no matter what the reason is that they're coming through our doors, whether it's physical health or mental health. And so that's one of the things that I wanted to touch on, is that some of you may or may not know that Bowen Health, formerly Bowen Center, over the past 5 years, we've been embarking in a journey on integrative healthcare model, which doesn't necessarily only mean that we have physical health services and mental health services under the same roof, but rather we have an interdisciplinary team that is working on behalf of one person to treat the whole person. And so that is available at both locations. And then the last thing that I want to talk about that is fairly new is our crisis receiving and stabilization. We have spaces that are quiet, that are safe in both of our locations in Allen County, where sometimes people don't know what they need and they don't know what the first step is to make that appointment. So if we have children or families in crisis, one message that we just want to send out there is send them to us. Bring them to us. We'll help them navigate through what they need, whether that is resources or services. And we have that space open and ready for them during our operating hours. And so on this slide, you can see there's the phone number in order to get in touch with us. We have information on our website, and you can refer patients, families, or schedule on the website. And then the last slide here is the information for me and Tim. So Tim, if you want to go to the next slide. Of course, we threw a lot at you in 6 minutes. And so if you have any specific questions on our services, please feel free to reach out to us at any time.
Thank you for the opportunity to share today. So
thanks so much.
I'll stop sharing.
Yeah, thank you both. And if anyone has questions for them, feel free to add them to the chat. We'll just address them at the end. All right, so I am going to go ahead, and I'm not going to go back to sharing my screen. I'm going to hand it off to Dick Hammond. He is the business development representative at Maple Heights Behavioral. So Dick, you can take it away when you're ready.
Okay, good morning. Thanks, Mary. And thank you all for allowing me to be here and be a part of this. I'm thrilled to be here. I do represent Maple Heights Behavioral Health Hospital. We're fairly new. We'll actually be 2 years old January 4th. We are at West Washington Center and Huguenard Roads. We provide outpatient programming for adults and adolescents, as well as inpatient stays. We're a freestanding behavioral health hospital, and the hospital has 6 units here. As of today, we have 3 of the 6 units up and running, 2 of which are for adults 18 and older, and we also have 1 unit for adolescents, 12 to 17-year-olds. That unit continues to grow constantly. We have had a couple situations where we have used the unit next door. We hate to turn people away and to say no, but we are seeing more and more of the adolescent age group. I have 10 counties that I get to represent Maple Heights in and make connections with. School districts are truly one of my favorites, and that's because I'm so happy to be able to explain to them and let them know what services are available, because they are constantly looking for, who can help our students and what can we do together. One of the things I want to say is that, we work with everyone. We're a partner. We work with Bowen, we work with, Parkview. We are basically an additional provider now here in the Fort Wayne community. And we're here for the patient, whether it's an adult or an adolescent, we're here for them. One thing I did want to highlight is our outpatient programming, IOP for adolescents. That program is now available virtual. And so we have a number of students in the county as well as outside of the county who are being able to participate in outpatient services, and they're joining that program virtually, and it is proving to be extremely successful. It takes away, the issue of transportation, which is huge. But we're very proud of that, and it's going very, very well. I have sent Mary an email with some materials that I would like each of you to have. Some of you have probably already seen those materials, but it kind of highlights the outpatient programming as well as the inpatient, and really what we do here. Lastly, I just want to say back to the partnership, we're not able to help every single person that comes to us. And so we are a resource, and we're happy, we're happy for Heather and her group to be here. Also Bowen Health, Northeastern Center up north of here in the northern counties. Again, I can't stress enough, we're here for the patient. And so I'm happy to be able to function that way because I do believe in that very, very much so. So I'll wait and answer questions at the end, but basically that is Maple Heights. I know we're talking about adolescents, but in March we will be opening our 55 and older unit. And I'm looking forward to that as well. So we can help tap into that age group.
All right, Dick, thank you so much. I really appreciate you being here today. And Heather, it is all yours. You're welcome to share your screen, or you can just chat from there. And
Okay.
I'm sorry, let me introduce this as, I'm so sorry, Heather Henry from Parkview Behavioral. And I will be sharing all of your contact information on the screen at the end.
Perfect. Thank you. All right. Let me see if I can do this right. Can everybody see it okay?
Yep, we can see your slides.
Excellent. Okay. So this may be something everybody's seen a million times or not, but I did tweak it. So good news, there is some difference in it. But SOS, I am the manager of the SOS program. We're the mobile crisis team for PBHI Park Center. And it used to be if someone needed help, they threw a bottle into the ocean, and that's how they got the help. Today, we have the helpline. It's 24/7, as well as 988, to be able to get that help you need. So kind of how the mobile crisis, I'm going to really focus on my mobile crisis team, but I do have other Park Center information as well in this presentation. People reach out to either the helpline or the 988, and they screen for the level of need for the person that's calling. SOS does respond to emergent calls within an hour. Allen County, 2 hours for outlying counties. If we have urgent calls, we have like the on-deck system. I'm working right now at beefing up my mobile crisis teams with the goal of the 8A to 8P. We will have 3 teams. And overnights, right now we have 1. The weekends we have 1 team, days, and 1 team overnights as well. So we are 24/7. If someone needs transportation to the next level of care for more assessment, and we're unable to de-escalate, we do transport to the emergency department. We do go where they want us to take them. We do not take everybody to Parkview. We have Maple Heights as well as Bowen. We call them on the regular. So we take the people where they're going to go, that they're going to get the best care they can receive for their needs. We do serve 11 communities in Northeast Indiana. There are times when the teams will be out and there's a need, say in LaGrange. What we'll do is we will partner with other mobile crisis teams that serve the areas as well. Because like Dick said, it is about our patients. That is our priority, and their safety is our primary concern. So if someone else is available and we're not, we're going to make sure that they get in touch with those people. When we're out, when the teams are out, the things that we do, we de-escalate the crisis, we screen for suicidality. We're going to assess for their level of need. Even though the helpline or 988 has been assessing them, Sometimes when they're face to face with somebody, it's amazing how the situation changes, and it can sometimes be worse than what it was reported, or it can be better. We complete a safety plan with the patient as well as their support people if they're available to work on with us. And then we also do counseling on access to lethal means, which is really, really important because, again, the safety is our priority. We're very fortunate. We have partnership with the VA, so we get gun locks free. So we talk about gun locks and medications, as well as if it's a vehicle where what we can do with those car keys, to keep that person safe. Once the immediate crisis is over, we do notify if they're a Parkview patient and the primary care provider is the one who's doing the meds. We're going to make sure that the meds, as well as their care team, if they're connected to services. So if they have a case manager, we're going to make sure the crisis note gets routed to both the provider and the care team. So we have that continuity of care, and we're all on the same page. If they don't have a primary care provider and they need one, we're going to get them connected to one because I'm a nurse. So of course, my people are, even though they're social workers, that is the golden rule. You're going to have a primary care if I can help it. If they are connected to mental health services, say Bowen, we're going to make sure that we'll have them call Bowen while we're right there with them to make sure that the point is getting across, the right communication is being made, and we can see if we can get them in to be seen sooner than maybe their next scheduled appointment. Perhaps they need a med tweak, or, they need to see their therapist. We're going to work with them and whoever they're connected with to get them that. In the meantime, if they are needing connected until they get connected to services, the team will do temporary case management. We follow up the next day. I like to say it's usually, I'd like to say it's always, but I'm going to say it's usually one of the two team members that went out on the crisis call. But if it's not, it may be another team member. If it was their third day and they're both off for the next 4 days, then a team member will be reaching out to follow up with the patient and the family. Some of the places we do connect them to is the homeless team, Claim Aid, if they don't have insurance, food bank, shelters, trustees, whatever the need is. Some of the other services, we are very fortunate if they're not connected to services, we have priority slots so we can get them into a diagnostic sooner than later to get set up for services. We have IOP, that's 3 days a week, 3 hours each day for anywhere from 8 to 12 weeks. We have adolescent substance use IOP for 14 to 17-year-olds. We have 2 different IOPs then for the mental health. IOP and DBT is for ages 11 to 14. And then the adolescent wellness is 14 to 17. We do offer school-based services. We're currently working with Fort Wayne Community, Northwest Allen. And the school-based services, we provide therapy services as well as case management. And then they have community and family supports as well with home-based services, peer support, recovery services, and then wraparound services. Some of the little accomplishments we had July 1st, the mobile crisis team, I pulled the Band-Aid off and we were getting too comfortable. We went to 24/7 services. November, we received our designation as a mobile crisis team, which allows 988 to reach out, have that access to our team to respond to crisis situations. And we're in the process of building out a crisis receiving and stabilization center as well. It right now is looking like it'll be located at 1909 Carew Street, but there's more to come and I'll keep everybody updated as things happen. And that is it.
All right.
Hopefully-
Thank you so much, Heather. I will go ahead and share your contact information. I know we're just about to 12. So if anyone does have to hop off, I will be posting this full recording so you won't miss the questions if you want to watch that later. So let me go ahead and reshare my screen. Can everybody see that slide? Okay,
Yes.
Perfect. So there is Dick Hammond's email address. If anyone needs that, keep it up there for just a second. And then here is Heather's. So again, all of our guest speakers, thank you so much. Just for everyone that's still on the call, I know I've talked about it before. I was a teacher in addition to working in public health. So having been a teacher, I know that feeling when you have a student that you can tell is in crisis and you know what you're trained to do, but then you still wonder, what actually happens after you make that call. So you now have the contact information for 4 incredibly knowledgeable people in the area who want to help these kids. So please reach out to them. Mental health services, my goal is to make it less scary for people working in education. I've been fortunate to visit, a few of these different facilities, and they're much more welcoming than I think a lot of people expect. So please reach out to me. I have a lot of resources for all of these people, and I would be happy to open it up to questions. So if anyone would like to unmute themselves, or you can type the question in the chat. I didn't see any questions yet, but I'll scroll back through the conversation. Okay, I don't see any questions in the chat, so feel free to unmute. Anybody have any last minute questions?
Mary?
Yeah.
What are the ages for the safe babysitter? Because we're in elementary, we're having more and more 4th and 5th graders taking care of younger siblings until parents get home. Is that ever an option for them to take something like that, or you don't really like that until they're older?
We could definitely expand it down. I would just have to confirm on the CPR. We may not issue the full card at that age. But if you want to send me an email, we can absolutely adapt that class and still teach it to that young of a kid. No problem.
My last question too, because we just had this principals meeting yesterday. Do you have any information on the
Rochelle, you are really breaking up. If you could say it one more time or type your question in the chat.
Can you hear me now?
Yeah, much better.
Okay. We just had this question with our principal at our principal meeting yesterday about the temperature and going outside for recess. Do you have any information on what guidance that you guys would suggest?
Yes, so we have guidance from the state health department. It is actually in a chart. It depends on both temperature and wind chill. So I would be happy to attach that to the follow-up email. Just make sure your email's in the chat, and I'll just include that because we've had a lot of schools asking.
Great.
So it's not a set temperature. It kind of depends on multiple factors.
Great. Thank you.
You're welcome. Okay, and Mary, thank you for that addition on the CPR card. I'll take note of that. Thank you. All right, any mental health related questions? I'm happy to answer questions as well, but we've got 4 experts here. So it can be, even if it's just a personal question that you have on what happens once students enter these programs. All right, for my 4 speakers, is there anything you did not get a chance to say? I know we're a few minutes over, but if you have a last comment you'd like to add, we have time for it if you do.
I did have just one comment to add. I wanted to mention that Bowen will never turn anybody away regardless of their ability to pay. So I know that there might be some conflicting information about that out there, and I just wanted to make sure that everybody had the same consistent information that their patients should never be turned away, regardless of their insurance status, if they don't have insurance, if they're unable to pay. And so I just wanted to make note of that.
All right, thank you. Anyone else from our speakers?
I'd just like to throw in one little encouraging word to all of you out there. With our student assistance program that we've had for, about 25 years, we learned something I want to make sure everybody understands. If you give a kid and a family an opportunity, just come and talk to you once, the power of one, that one conversation, Heather was talking about it too just a second ago, that power of that first conversation. We learned over 25 years, if you give somebody an opportunity just to have one conversation, they're 80% more likely to go on and further their investment in their life. So make sure that you reach out to, Maple Heights and Parkview and Bowen. And if it's none of us three, reach out to somebody, help them get connected with someone where they get a little relief valve happens in that one conversation. And it usually moves on to something more of an investment in themselves, investment in the family, and it gets them in a better spot. So don't ever underestimate just what one conversation could do. I just want to let you all just know that's the powerful platform we have. And Mary, thanks for getting us all together today so we can have these kind of conversations with you. So, but I just want to leave with that.
Yeah, well, thank you so much. I know we're a few minutes over. So everybody, thank you for your time. This was recorded, so it will be posted hopefully by Friday. And everyone enjoy your day and happy holidays.
Thank you.
Thank you.
Bye.
Thank you,
Happy
everybody.
holidays.
Holidays.